Hey everyone, so this is going to be our first video on the topic of anaphylaxis. So anaphylaxis is the end state of a severe allergic reaction, and someone might have to an allergen, say something like penicillin or peanuts or shellfish. Any of these things can cause an anaphylactic response that can be anywhere from extremely uncomfortable to life-threatening. So today we're going to talk about the symptoms. We're going to talk about the diagnoses. And we're going to talk about prevention. Okay, so let's get started. So what are we looking for when we fear that someone is suffering from anaphylaxis? So we're going to categorize these. So the first one is anything topical. So you're looking at the skin and the top of the body, basically, to see if there's anything that might indicate that someone is suffering from anaphylaxis. So we're looking for things like rashes, right? You can have rashes on the arm, on the legs. You can have itching break out in the groin area or in the armpit area. You can have hives break out. You can have swelling in the eyes and in the lips. So these are all things that present on the surface of the body that could indicate that someone is suffering from anaphylaxis. So the second category is psychological aspects of this reaction. So usually what this means is anxiety. So people start feeling for no reason that they have some just weird feeling. They just don't feel right. They feel uncomfortable. They feel nervous. So this is going to be our little anxious person, right? Sweating it out, wondering what's going on, what's going on. So if you're sitting with someone and you're eating at a restaurant and all of a sudden they start feeling itchy and nervous, and it's not, of course, a first date, then maybe there's a chance that they're going through an allergic reaction. So the next thing we want to talk about is a set of symptoms that you're going to hear. So respiratory symptoms. Right, so what's going to happen is the windpipe is going to close down in the event of a severe allergic reaction. And this happens because the inflammatory agents that are released in order to combat the invader cause a contraction of smooth muscle tissue around the windpipe. Draw a little man here. Okay, so you're going to have this windpipe sort of closing down, and it's going to become very difficult to breathe. So you can listen for a situation known as stridor, right, which is a wheezy inhalation sound. If you've ever run to the top of a hill or run wind sprints, at the very end, when you're breathing in and say you have some phlegm at the back of your throat, it creates a sort of wheezy sound. So it's similar to that. It's basically something that's getting in the way of you breathing, and in this case it's going to be the windpipe closing down. So you're listening for wheezy inhalation and looking for difficulty of breathing. So the next thing we're looking for is anything gastrointestinally related. Right, so I think the best way to represent this is through the universal gastrointestinal distress sign, which is a toilet. So basically anything, toilet related. So if you have stomach cramps, if you're vomiting, if you have diarrhea, these could all be indications that your body is going through a severe allergic reaction. Okay? So last but not least, we're looking for lightheadedness. Okay? It's a nice long word. Lightheadedness, because what that means is that the body might be experiencing low blood pressure. Okay, this is a drop in blood pressure. Now, the drop in blood pressure is serious because what happens during anaphylaxis is the immune components that are in circulation in the vascular system are going to rush into the tissue. When you have all of those components rush into the tissue, they carry fluid from the circulatory system with them. So you're going to have a drop in blood pressure that, if it gets too low, can be life-threatening. Okay, so the diagnosis sort of goes along with all of these symptoms, right? So if you have a combination of these symptoms, then you can sort of deduce that there's a good chance that someone is going through anaphylactic shock or is on their way to anaphylactic shock. So it's good to keep an eye out for these things in the event that someone is going to need medical attention. So let's talk about prevention. What can we do to help prevent anaphylaxis from taking hold? Okay, there are a couple of things we can do. The first thing, you can be allergy tested. So this is a good thing to do just so you know if there's anything that you could consume or ingest or receive intravenously that could cause you to go into anaphylactic shock. So the way that they usually do that, draw a little arm here, really fat fingers, no elbows. Okay, poor guy. So what's going to happen is they are going to put a bunch of little pricks into your arm that contain various allergens, right? And if you're allergic to something, one of them is going to get really big to indicate that you have an allergy to, say, coffee, in my case, which is not good for a budding medical school student, but you just got to kind of get by. So the other thing you want to do to prevent anaphylaxis, I should say the next thing, because there are other things that you can do, is allergen avoidance. So I know this sounds pretty straightforward, but you'd be surprised how often people forget to ask if a place that they're at might contain a certain allergen. So I'm thinking about food allergens specifically. So say if you are allergic to peanuts, then you might think twice about eating at a place called the Vietnamese Kitchen. Alright, so Southeast Asian food has a lot of peanuts in it. You might want to think twice before you step foot in there. So it's good to know where you're likely to encounter your allergen, right? So you can avoid those places in the future so you don't have to worry about going into anaphylaxis. The third thing, to prevent a really serious reaction, call for medical help. You know, if the reaction is getting out of control, be sure that you call a medical professional, because sometimes it requires a little bit more medication and treatment than you're able to give yourself. And the last thing, and we're going to talk about this more in a later video, but give yourself the medication that you already have to treat your anaphylaxis if you know you're prone to it. So for example, an Epipen. So an Epipen is a small marker looking device that has a dosage, kind of looks like that. It has a little trigger here. Okay, it has a little dosage of epinephrine in it, and epinephrine has the exact opposite physiological reaction in your body as the inflammatory agents that cause anaphylaxis. So the inflammatory agents that cause anaphylaxis are going to cause your blood vessels to dilate and become leaky, and it's going to cause the smooth muscle around your windpipe to contract. Epinephrine, or adrenaline, is going to cause your blood vessels to become smaller and less leaky, and it's going to relax the smooth muscle tissue around your windpipe. So it's good to always have your medications on you and be ready to take them if necessary. So that's an introduction to anaphylaxis. We're going to go into the pathophysiology and the treatment of anaphylaxis in subsequent videos. Thanks for watching.